Hello and welcome, this is Preeti and today's video is about diabetes and insulin. How many types of diabetes are there, what is diabetes, what insulin does for a diabetic. So all these things we'll know in details today in this episode. So let's get started with the video. Diabetes is a condition in which there is too much of blood sugar in the body. This occurs due to the inefficiency to your productivity of the hormone insulin. Insulin is a hormone that regulates our blood sugar level, secreted by the gland pancreas, that is the beta cells. What does insulin do for diabetics? Insulin maintains the normal blood sugar level in the body. And if it is not maintained, too much of blood sugar in the bloodstream, which can cause various fatal diseases like insulin also signals the liver to store extra sugar as a storage, and when it is needed in use, it is being converted into glucose. That means in the storage form, glucose is converted into glycogen, and when the energy demands increase, it is converted back from glycogen to glucose. मतलब लिवर में जो एक्स्ट्रा शुगर है वो स्टोर होते हैं, और जब आपकी बॉडी को स्टार्वेशन पीरियड में जाना होता है तो वहाँ से वो एनर्जी लेती है. तो अगर आपका इंसुलिन वर्क नहीं करेगा सही से तो ये प्रोसेस बॉडी में डेवलप नहीं होंगी, और उस वजह से आपका शुगर लेवल जो है ब्लड स्ट्रीम में ज़्यादा अमाउंट में हो गया, और उस वजह से आपका हेल्थ पे बहुत इफेक्ट होगा. Insulin helps the blood sugar to enter the cells of the body so as to provide energy. अगर इंसुलिन का लेवल कम है बॉडी में और इसका प्रोडक्शन सही नहीं हो रहा है तो क्या होगा कि आपके सेल्स को शुगर्स प्रोवाइड नहीं करेंगी, और उस वजह से एनर्जी आपको नहीं मिलेगी. इंसुलिन हेल्प्स द ब्लड शुगर टू एंटर द सेल्स so as to provide energy. Due to insulin, the levels in the bloodstream, that is the blood sugar levels in the bloodstream decreases, and then what happens if the blood glucose level is above the normal range? It can bring to you a lot of diseases, heart diseases, stroke. It can cause damage to nerves, it can cause damage to kidneys, eyes. Once you are checked with the diabetes, the only option remains is that you have to make dietary modification and have a good exercise regime. Then only you can battle this condition and go ahead, because this is a serious lifestyle disorder and can only be prevented or maintained by this step. How many types of diabetes are there? There are 3 types of diabetes: type 1, type 2 and gestational diabetes. Type 1 diabetes is a condition in which there is no production of insulin by the gland pancreas, and develops a condition where there is an abnormal blood glucose level in the body. Type 2 diabetes is a condition in which there is inefficient production of insulin, or the production which is there and the insulin that is made does not work as well, which further again gives rise to the abnormal level of blood glucose level. And what is the cause of developing diabetes is because there is no healthy eating, no exercise, no physical activity, or if you're overweight, or there is any genetic inheritance, or your forefathers have this issue, it might also come to you. So now we will talk about the gestational diabetes. Gestational diabetes occurs in about 5 to 10% of pregnant women and goes away once the baby is born, but they have a high risk of developing this condition in the future. That's why good strategy is needed so as to combat this disorder. By proper eating, making some dietary modification and lifestyle changes will prevent coming back. We will know about the normal ranges of the blood glucose levels of our body. In normal condition and on a fasting stage, it should be about 80 to 100. After eating, 170 to 200, and 2 to 3 hours after eating, it should be 120 to 140. Pre-diabetes condition is pre-diabetic condition is अगर आपका ranges इस तरह का है तो pre-diabetic condition है. देखिए आप अगर आपका अगर आपका ब्लड ग्लूकोज लेवल फास्टिंग कंडीशन में 101 to 125 mg पर DL है तो आप डायबिटिक प्री डायबिटिक स्टेज में है. आफ्टर ईटिंग if 190 to 230 then you are going in a pre diabetic stage. After 2-3 hours of eating 140 to 160 mg per DL. And a diabetic fasting condition more than 126 after eating 220 to 300 mg per DL 2 to 3 hours after eating. Type 1 diabetes is life threatening if insulin is not replaced. People with type 1 diabetes need to inject insulin for the rest of their lives. Thank you so much for watching this video, and if you have liked the video, please do like, comment, share and subscribe to my channel and pass it to your friends and relatives. See you next time. Till then, take care of yourself. Bye bye.